of the different organizations. As you can see, there's Germany, there's France, Norway, Sweden, Denmark, you name it, we're almost all there. But let's take a look at it on a map. So as of today, most of Western Europe, all the organizations have come together under HHT Europe. Unfortunately, Belgium and Portugal do not have patient organizations, but the extraordinary thing is that we have also been fostering the creation of organizations in unrepresented countries. Thanks to Eurordis, which is the European Federation for Rare Diseases, we are reaching out to countries and national alliances in Eastern Europe, and hopefully we will foster the creations of organizations there also. How many people do we represent? 90,000 people in Europe statistically have HHT. That's an extraordinary amount. And it means that the more we work together in this community, the more achievements we can make. So let's step one little tiny bit further to see exactly our mission, which is basically exactly the same mission every organization nationally has. And we can summarize it into 4 different fields. We learn together, we represent you together, we share, and this is a very, very important part that I will be talking about, and we plan and promote. So basically coming together means being more able to accomplish the national mission also. And let's see in different fields exactly what each of these mean. So HHT Europe is 12 national organizations. It has a board of directors, national delegates. We meet on a monthly basis officially, but I would say, Dara, correct me if I'm wrong, I would say that there's not one day that goes by that our WhatsApp group or our small work groups are not working together on a project. So I would say there's a constant cooperation on all fields and reaching out to each other. Besides the general group, we have 3 very specific work groups because of the topics covered. One is the EPAG, which means European Patient Advocacy Group for HHT. There are 11 representatives, and we work with the ERN, the VASC-ERN. VASC-ERN is a European reference network for multisystemic vascular disorders. Then we have a CAB. The CAB is a community advisory board that is patient-led medicine. There are 11 representatives that work in very, very high-skilled tasks regarding clinical trials and promoting research. And this is an extraordinary team that works together and does a lot of important work. And finally, we have the newborn in our federation, which is our communication team. Each of us has a communication team nationally. We have brought all of these people together in order to share best practices, create campaigns that are joint in pan-European, just like the oral health infographic that we created together and Dara spoke to you about. And basically trying to answer the many questions all the patients have. And I've seen so many questions pop up today in a very structured way. Every time you ask a question, you are doing a patient organization a favor. I think this is the most important thing you should know. What we like to say in HHT Europe, but nationally we all agree, is that you are guiding what the organization has to do. Your questions, and we've seen this in COVID times so much, allow us to understand what the common problems and denominators are, and to feed you guides, infographics, solutions tailored to your needs. So never be afraid to reach out, pop an email, send a text message, or make a phone call, because you're actually helping many other patients by telling us what you need, both nationally, and then we share this at a European level, and we make sure the level of communication is actually more complete. So first of all, we said we learn. Learning is constant in life in any field we work in, but especially in rare diseases. We need patient advocates, the people that are frontline, that are volunteers, that are working, to have capacities, very specific capacities, and to keep up to date with everything that is happening. So we have an extraordinary amount of patient delegates right now who train in very different fields, specifically clinical trials. What does it mean to represent you at the tables where clinical trials are promoted? What does it mean to bring our perspective into clinical trials? Well, we're lucky because at a European level, there are extremely important trainings in this field that are promoted by Eurodis and EUPATI. So on drug development, on ethics, on clinical trials in general. And I would say that a vast majority of the HHT Europe volunteers have all followed these quite challenging trainings themselves. Also, there are different trainings on communication, how to communicate in rare diseases, and that's the digital school, which has been an extremely added value. And we're very happy to have these almost professional patient advocates in our volunteer group. We work online and offline, and we don't only learn from these institutions, we also do a lot of capacity building among us. This way, every organization is strong in something different, and we manage to share knowledge and keep each other at pace with what our tasks are and what your expectations are. We represent you. This is really important because in Europe, there are many different tables where patient advocates are called. They say, nothing about us without us. This is not a competition between clinicians or researchers and patients. It's a team job. So when we work together and we're called by institutions like the ERN, like the EMA, the European Medicine Agency, by different, even by pharmaceutical companies, when we're sitting at tables, we represent everything that we have built in our national communities and the needs of the patients. So here there's a lovely picture, if I'm not wrong, from Vienna, where we presented a poster at the ECRD, which is the European Conference for Rare Diseases that collects more than 1,000 participants between legislators, pharmaceutical companies, patient delegates. And we were there representing the HHT community in Baskern. And this is just one of the many examples I can make. But please, you know that we represent you every month in the Baskern, bringing your voice as a community. And we share and we plan and we promote. These are three things that go hand in hand, because by sharing ideas among us, what we managed to do is to save a lot of energy, see what has worked in other countries, apply it if necessary to our own. Examples are different guides, the oral health guide, campaigns such as My HHT Valentine, trainings, because this was really important, the emergency guidelines for HHT. Everything that's been done in one country is shared. If it has been successful, we evaluate if we need to do it in our own member state. And then we already have the project up and running, and it saves time, it saves a lot of money, therefore we can optimize, and it allows us to be democratically reaching every single patient in Europe. Now, this year, although it has been a huge challenge with COVID, because everything was to be understood, I would definitely say that it was one of the most satisfying experience as HHT Europe, because there was not one week that went by that we did not have meetings. We started collecting all the questions that were coming through nationally. You would be amazed to see how across all of Europe, the questions were exactly the same. There were questions in March, questions in June, questions in August, and they just kept coming in these flows, and we were able to work together. We were able to benefit from the extraordinary work of our clinicians nationally, put them together across HHT Europe, and publish all the information that you could need. And this was of great support for the volunteers, because volunteers' job during COVID has been strenuous. We've been answering, I always make the example of HHT Italy. We have an average of people calling us annually of about 420 people that call our helpline, or 420 calls. This year we had, in 2020, over 950. That just goes to show you the needs have gone up in an incredible way. And I would say that most of us wouldn't have been able to make it if we didn't have the support of HHT Europe, the clinicians across all of these centers that have helped us deliver answers to you. And please remember that during COVID times, it has been extremely difficult for clinicians to answer your questions because they were in COVID hospitals. They were not able to answer as timely as they usually did. So we bridged that need and we did it together. So this is the many, many things we do here. We have a picture of our just last campaign. I just put one as an example, which is our communication team is celebrating women in science in HHT or that have HHT. And it has been extraordinary because we've gotten to know the expertises in different countries. The more we know, the more we can share with you. So these are other examples. Our school guide, I'm sorry they're in Italian, but I didn't have the English versions, but right here at the bottom, you see the pencil, and that's every year in September, we send out a school guide. That was a best practice in Italy. Parents had asked us, begged us to have a reference to give to schools and to tailor to the needs of their specific child. This was an idea that we shared in HHT Europe. It's been translated in every European language. It's sent out. Parents benefit from it. Children benefit from it also. Our HHT Valentine campaign, and as you see here, this is our COVID campaign that has been going across Europe in sharing all of the knowledge we needed to do. Where do we represent you? We're in Europe, and there are some extremely important institutions, and we just wanted to put them through here. The European Medicine Agency, where many of our patient advocates who have done very high training in clinical trials in drug development do represent HHT at the agency. In the European Union, because most of you have also participated in some of the surveys like Rare 2030 that come through from the European Union because they want to hear your voice. Right now, there's a creation of the next 10 years of investments and legislation around rare diseases. And the fact that your patient organization in HHT Europe has been promoting and bridging these surveys to you means that your voice reaches the European Union, and this is essential. The Vascurin, which if you have never seen the website, do pop in and see it. It's vascurin.eu. It has been 5 years now, this revolution in the management of rare diseases, cross-border care and expertise, and 11 patient advocates from Europe work constantly in this group to bring your voice. And of course, Eurordis, which is the Federation of Patient Organizations for All Rare Diseases, where we represent HHT, but mostly where we benefit so much from their training and guidance and support, and they've really allowed us to grow extraordinarily. So this is just a closing picture from Vascurin, where you can see the last Vascurin days, which are always extremely long and challenging, but satisfying in the results. And you can see here, the beauty is the mixture of clinicians like Sophie Dupuy-Giraud from France, Carlos Abba from Italy. There aren't all of them on the screen because there were so many of us, but then also all the patient delegates. So patients and clinicians working together. So this is my small part on HHT Europe, and please do follow, and please do remember that your voice in Ireland reaches Europe through your organization. This is extremely important, and thank you to all the Irish volunteers who are in HHT Europe, because you really do make a difference from day one. Someone before said that you're a small organization on the outskirts of Europe, on the borders of Europe, but I have to say you have been really determining some of the great successes we've been accomplishing together. So my special thanks. Where there's a will, there's a way together. And now one of those best practices, Dara asked me to kindly share with you from HHT Italy, something we do that has been one of our, I would say, highest challenges, because we were very concerned about starting this, but one of our greatest accomplishments in satisfaction from our patient community, and it's our youth program. So Derek, can I continue, or did you want me to stop? Okay, I'll keep going. So what you see in this picture here are our last edition of our youth program and our HHT superheroes. These are some of the children that did a superhero camp on HHT. It was, I think, the 4th edition of the camp. And I'd like to tell you about how it came to be, what the aims are, and what the success we'd like to share with you is. So this is our experience. This was all parent driven. So parents used to come to our national meeting every year, and a lot of them that couldn't come would say, well, I can't bring my children. I don't know where to leave my children, so I won't participate. And that was just already one little element that made us start thinking, well, it'd be lovely to find a way to bring the kids along. But a lot of parents during the conference also told us that they had a huge problem talking to their children about HHT, raising their children with HHT and making them aware and making them feel comfortable, because you can feel comfortable with a rare disease if you have the knowledge that you require. We didn't have a previous model in HHT organizations of a very well-structured camp for children. So we looked to other organizations, Aniridia, Cystic Fibrosis. Other organizations were great help in helping us plan this. And we've had 3 editions, 3 since 2016. Every year, 30 children between the age of 4 and 18 have participated. We'll be very sincere. The first edition, we thought 2 or 3 kids would show up and it would just be our own. Instead, it was extraordinary because the average was 30 to 35 kids in each edition. We divided them in 2 groups, age 4 to 11 and 12 to 18. This way they had tailored to their needs the experiences that we offered. And most of all, we included non-HHT siblings. This came from the Aniridia community. They taught us that they did their camps for children with the siblings that did not have Aniridia, because you would be amazed to know that a lot of these children that don't have HHT but have a sibling with HHT are extremely concerned about their health, the health of their brother and sister and of their parents, and they usually don't feel free to ask. So when they come and they have a space, they can listen, they can ask questions, and they actually don't feel isolated towards the disease, which is a family affair. So we started and we decided our aims. What do we exactly want to do? We wanted to support families, so give families the possibility to give children awareness about their children's condition, supporting siblings. This way they could handle the emotional burden, but also be of help to the family. And most of all, support the children themselves in order for them to overcome fear, stigma related to HHT, and become in charge of their condition. You'll see at the end of this that the extraordinary thing is that children now go for screening with a completely different attitude. They're almost proud. It was funny because at one of our last editions, one of the siblings that did not have HHT said, wow, you guys are really lucky to have HHT. It was so weird because he had so much fun and they had their t-shirts and their caps. And it was just something to be proud of and be part of a community. I'm sure most of you were raised without knowing someone who had the disease and maybe just knowing someone in the family, but reaching out from a very young age and having this kind of mutual support can really make a difference. So what's the format? We have a 2-day event because that's the way we do our adult conference. So the adult conference is 2 days. We always try to add, even for the adults, some free time together, a tour of a museum or something like that. So in parallel, we did the same thing with the children. So the parents come and they drop off their kids at the youth camp and they do their own adult program. Children get HHT knowledge in an appropriate language. Every year we cover a different topic. The clinicians have a ball. They enjoy every minute of it. The last edition, the ENT turned up with his surgery outfit, painted with different colors. And he walked into the room with the small children and they say, why is your outfit all dirty? He says, because I just operated an HHT Barba Papa. I'm not sure if you've ever seen the cartoon with all those little figures that are different colors. And so he said, this is the result. And the kids were all laughing. And he taught them how to manage a nosebleed, how to manage a nosebleed or help an adult in the family with HHT. And then the kids made their superhero capes because they were nosebleed superheroes and they knew how to manage it. We also do team building. Team building is not necessarily related to HHT. They do music activities, sports activities that create friendships that are actually long lasting. They have a lot of fun events. They go to museums, they go to amusement parks. So we organize it around what the territory offers. And at the very end, all the children come back into the plenary session with the adults and they present anything they created. And most of all, they have a rap song. The kids wrote a rap song around HHT, which actually is extremely funny because it talks really funny about the doctors and about the parents with HHT, and they sing it all together to the plenary session of adults. And it really brings a lot of joy and the parents are really, really happy about it. These are just some pictures because seeing these faces of these children, most of them now are, this little girl you see here sitting at the table, she's now 12 years old. So they've grown with us. You see the volunteer with the balloons leading the children out of the plenary session at the very beginning, games and activities, coloring, pool parties, just the group. Most of these kids have grown up so much. Another one of our volunteers, we find volunteers in many different areas. It's not necessarily parents because we want the parents to attend the conference. It's either local organizations or friends of the family that come in and support us. Here is one of the last editions with our little Camila creating her cape. Actually, you see here the number of children is extraordinary. And in the back row of the group picture, there are all the pediatricians and ENTs that worked with the kids in that session. And these are the small kids. I want you to take a look at the adolescents. Now, this was tricky because adolescents clearly have more of a problem with opening up and maybe the attitudes can be different. Instead, I have to say that they were the greatest surprise. This was in Orvieto, which is a beautiful city in the center of Italy in Umbria. And we organized in the city itself, oh goodness, how do you say it in English? A scavenger hunt. So they had to do a scavenger hunt and they were different teams. They had Team Rendu, Team Weber, and Team Osler, and we divided them in groups. And they had to do a certain amount of things, find different treasures in the city, interact with the people, give out flyers. They had a ball. And I'm publishing only the pictures they took of themselves because I think it really shows how much fun they had. And they've been coming back in every edition. And they have actually created a WhatsApp group. They've met during the summer in different vacation locations. Some of them now are over 18. They've gone on vacation together. So this community is actually growing on its own, and 2 of them have become volunteers for our organization. Here we see one of the first editions with the adolescents. With the adolescents, we have a psychologist that helps them. So it's not very invasive. She's just present and she guides any kind of debate. They clearly have more questions, and they've also created some informative videos. So how to do what my challenges with sports and HHT are, what I do when I go on vacation with HHT. So we do a lot of capacity building, and the community is extraordinary. These kids are really growing very well together. Now, what are the outcomes? First of all, we always send out a survey, and every year the families are extraordinarily happy. The appreciation is rocketing, and the requests keep coming back that they want another edition the following year. We also survey the children through the parents, and usually the question is, when's the next HHT party? Because they call it an HHT party, so they're all very happy. They send us pictures of going to school with their HHT t-shirts. A lot of children have done presentations in class, grade 5 and 6. When they talk about the human body, they present the vascular system and they talk about HHT. So they've asked us for support in creating this. And most of all, we've seen more compliance with the families, more sense of ease in going in for pediatric screening. We have a pediatric center in northern Italy, and there has been a great increase in participation. And as Dr. Brady was saying before, here in the beginning, it used to be around age 12 that you would do a screening. Now parents and children actually are wanting to go earlier because they've met the doctors, they know more about it, and they actually pair the children up so they can meet with other friends when they go for their screening. So they do it together. They'll meet another child that they saw at the camp, and they sort of coordinate it for them to do it together. So that's just another little part of our sharing. We really hope that this will take off in other European countries because it's been great for our families. This is our last patient meeting where I just wanted to show you our Italian community. And if you ever do decide to create a youth program, please do count on us because we share and we help each other. And we'd be very happy to give you, if you put together a team for a youth program, to give you a hand.